May 31st has been declared as the World No Tobacco Day by the World Health Organization with the goal to spread the message, tobacco threatens us all.
Now we all know how tobacco is harmful for the ones who actively smoke. But the fact is that tobacco also has devastating social, environmental and economic effects.
Today, on this very special episode, Doctors on Call looks into the various impacts of tobacco and what you can do to help quit. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta, and welcome to Doctors on Call.
India is the second largest consumer of tobacco in the world. In India alone, every year, tobacco is responsible for the death of at least 1 million people. In India, people use both smoke and smokeless forms of tobacco. Now, a smokeless form of tobacco would be chewing tobacco like keni, zarda or gutka. Cigarettes, hookah and more commonly bidis are used in the smoke form. Any form of tobacco is deadly. Tobacco increases the risk of cancer of the lung, mouth, throat, nasal cavity, esophagus, stomach, pancreas, liver, kidney, ureter, urinary bladder, uterus, cervix and even the bone marrow. The list is endless. All this because you smoke.
Absolutely. It also increases your risk of heart disease by up to 4 times. It increases your risk of stroke, respiratory problem and osteoporosis. And you know what? Even TB. According to data, up to 40% of tuberculosis load in India is due to smoking.
And this is with any form of tobacco. What we're trying to say is that please realize the impact of what tobacco, whether chewing or smoking, does to you in the long run. So the biggest question comes up, how do you quit? What are the different options?
Despite knowing how bad nicotine is, many people still continue using tobacco and have a hard time quitting it. But what is the reason? To know more, we spoke to Dr. Sonali Jhanji, Professor of Psychiatry at the All India Institute of Medical Sciences.
Usually it starts in the context of friends smoking, there is a lot of curiosity and there's a lot of peer pressure to start smoking, and people want to experiment at this age, at the younger age, and there may be a lot of influence of advertising, plus cigarettes and bidis and smokeless tobacco is really widely available, so it's very easily accessible. So these are some of the reasons why people might like to experiment with smoking. And at that age, one of the most prominent factors is peer pressure. Family member who's smoking, then you're more likely to smoke. So a lot of factors which go into initiation of smoking. If there is a family history of nicotine dependence, then there may be a genetic predisposition. That person may not be able to quit because he's a genetic vulnerability to continue tobacco use. Then if there are people who are very stressed out, who are kind of anxious personalities or depressed, even these people, they find nicotine, once they start, they find it very difficult to quit. A large number of people, they think that they can quit whenever they like and they can quit through willpower alone. This is not the case. So one thing is that medical treatment is very important. Now the second thing is that there are 2 lines of treatment. One is drugs, giving drugs, and the second line of treatment is counseling. The third is when you combine, for best results, you combine both together. Now that's very intensive treatment and it produces very good results. Now amongst the drugs, we have 3 main drugs. One is nicotine replacement therapy, which is available in India in the form of nicotine gums, patches, lozenges, so nicotine replacement therapy makes, it takes care of the withdrawal symptoms, it reduces the craving, so the patient is much more comfortable if he takes that form of treatment. The second drug is bupropion, it's an antidepressant, and varenicline. So varenicline is another compound, and especially for smoking cessation, it's been found to be the most effective drug.
Within 1 year of you quitting tobacco, your risk of heart disease is about half of that of a smoker.
And your risk of stroke after 5 years of quitting is similar to a non-smoker. Tobacco is actually the #1 preventable cause of death.
The Union Health Ministry has a toll-free number quit line where you can call for help and guidance on how to quit. Not only that, You should also speak to your doctor regarding quitting tobacco and how you can go about it.
Our team of doctors on call gives a big shout out to everyone to please say no to tobacco. See you next week.